Hi, Shadowville. My name is Karina, and I'm a registered nurse. I have made a presentation for you all on hypertension prevention and management. So I'm going to share my screen so that you all can watch the presentation. All right, so as I mentioned, this is on hypertension prevention and management, made especially for you all in Shadowville. So what exactly is hypertension? I have this very short video for you from the National Heart, Lung, and Blood Institute to explain how hypertension harms your arteries.
High blood pressure, or hypertension, is a common condition in which the force of blood on the walls of your arteries is often too high. Arteries are the blood vessels that carry blood away from your heart to supply your tissues with oxygen and nutrients.
So as mentioned in that video, hypertension damages your arteries, which are responsible to carry the blood to your other organs in your body. So if those arteries are damaged, other organs in your body may not be getting the proper blood supply that they need. According to the National Heart, Lung, and Blood Institute, half of all Americans are walking around with hypertension. That means most likely half of all of you in Shadowville are also walking around with hypertension. I highly doubt that half of you are already diagnosed, which is why we're talking about this today, so that we can learn how to monitor our blood pressure at home, take the action steps that we need to keep our blood pressure in control, and prevent anything from getting worse if we already have hypertension. High blood pressure often presents with absolutely no signs or symptoms. That's right. That means that typically you're not going to have any symptoms of high blood pressure until it's super problematic and you're probably already in the hospital. That's why it's so important to know how to monitor your blood pressure and keep an eye on it before it gets to that. So untreated hypertension can lead to things such as stroke, dementia, heart failure, coronary artery disease, aneurysm, kidney disease, and even eye damage. Again, when the arteries are damaged, that blood supply cannot get to those other organs in your body, leading to all of those problems. Since there are often not signs or symptoms until it's too late, it's so important for you to monitor your blood pressure. So you might be thinking, I don't even know how to take my blood pressure. I don't know where to buy something to take my blood pressure. I don't even know what a normal blood pressure is. Luckily, there are a lot of tools out there for us to help us with that. This is an example of a blood pressure reading chart. I'm also going to have one for you in the comments that you can print out and put wherever you might find it helpful. So the blood pressure categories are normal, elevated, high blood pressure, which is hypertension stage 1, high blood pressure, which is hypertension stage 2, and then there is hypertensive crisis. We definitely want to avoid getting to anything near a hypertensive crisis. The numbers over here tell you what they would have to be to fall into that category. If you look, there's often a range for the numbers. So it's important to pay attention to where you fall in those ranges. When you're monitoring your blood pressure, it's good to keep a daily journal and write down your blood pressures. If you take your blood pressure and it's too high and it falls in one of these higher categories, wait 5 minutes, relax, take it again, and make sure that it was an accurate reading. Make sure that you visit your primary care doctor. There is also primary care available at the Shadowville Health Department. So how do you know if you have high blood pressure? Like we said, you don't unless you take it because there's often no signs or symptoms. It is known as the silent killer for that reason. Monitoring your blood pressure at home is easy and it's very cost effective. Most insurance companies even pay for you to have a blood pressure monitor at home. If they don't and you need assistance with that, please visit the Shadowville Health Community Center and they can give you some assistance in getting that. So how do you purchase a valid blood pressure monitor or check and see if the one that you might already have at home is a valid blood pressure monitoring system? stridebloodpressure.com, which is www.stridebp.org, will allow you to type in your model or even just do a simple search for your model to see if it's a valid device. If you don't already have a device, they can walk you through all of the steps, including letting you know what ages it's appropriate for, the different size cuffs that they have, and if there's an expiration date on it. Monitoring your blood pressure at home is easy. It's just a few simple steps. I've also created a handout for this that'll be in the comments where you can download and print it and put it wherever you might find it helpful. So to measure your blood pressure at home accurately, you want to make sure that you're prepared. You want to be sitting down, uncross your legs, relax, and be comfortable. If you find yourself tense or uncomfortable, your blood pressure reading is not going to be accurate. Make sure that you expose your upper arm. So you want to pull up all of the clothing. You don't want to put the cuff on top of the clothing. Pull up your clothing, expose your upper arm. Make sure that this isn't too tight. If when you pull your clothing up, it's creating a tight band up here, take the sleeve off. Expose the upper arm. You're going to place the cuff. Make sure that your palm is facing up, and then you're going to relax your arm on a table, a chair, anything where you can relax it at your heart level. You want to avoid having your arm up high above your heart or down low hanging. After you're relaxed and you're sitting down, your palm is facing up, so it's supported and not stressed. You're going to remain calm, relaxed, and make sure that you're in a quiet environment. From there, you're going to just follow the directions on your blood pressure monitor. Most of them are just going to have a simple start and stop button. When it's done, the reading will display on the screen. The number that displays will have a top number and a bottom number. It'll look similar to a fraction. The top number is the systolic. The bottom number is the diastolic. As we talked about with the other chart, it gave you two different measurements, one for the systolic, one for the diastolic. If it's high, you're going to wait 5 minutes, make sure that you're relaxed, and take it again. You want to avoid taking your blood pressure back to back without any waiting period. If that number is still high, make sure that you let your physician know or seek medical attention, especially if it's higher than 180 systolic or higher than 120 diastolic. Remember, 120 or higher systolic and 80 or higher diastolic is considered elevated blood pressure. So how can we reduce our risks of high blood pressure? Well, there are some things that we can't help. Genetics is one of them. However, we can make sure that we're eating a balanced diet, that we are exercising and staying physically active, that we are managing our stress, that our alcohol and caffeine is in moderation only, and ensuring a quality sleep schedule. One of the biggest things for people to avoid hypertension is to make sure you stop smoking. Assistance is available to stop smoking. If you don't have a primary care physician or you don't feel comfortable talking to them, go ahead and visit the Shadowville Health Community Center, and they can definitely get you started on quitting your bad habit of smoking. So how do you control the high blood pressure? You can do it. You can do it yourself. Stay active, quit smoking, eat a healthy diet, manage your stress level, maintain a healthy weight, limit alcohol consumption, limit caffeine, work with your doctor, and take all your medications as prescribed. It's so important to make sure that you establish a primary care physician or PCP and see them as directed. You want to be seeing your primary care physician at least once a year or more often if needed. They will probably let you know to monitor your blood pressure at home if there was any signs or symptoms in those numbers of it being elevated. Make sure that you do that and report back as directed. Any prescriptions you are prescribed, make sure that you take them and you take them as directed. So we're going to recap. High blood pressure, it is the silent killer, meaning it normally has no signs or symptoms. High blood pressure is when the systolic is above 120 and the diastolic is above 80. Monitoring your blood pressure at home is easy. Visit stridebp.org to help you find a reliable and valid device to monitor your blood pressure at home. Again, most people with high blood pressure have no symptoms. So monitoring and routine medical exams as ordered and recommended are so important. Though there are some factors that can lead to high blood pressure, there are some that we can do to help. Practicing a healthy diet, exercising or staying active, limiting alcohol and caffeine, ensuring a healthy sleep regimen, reducing stress, and quitting or avoiding smoking altogether will directly help keep blood pressure in control. So to test our knowledge, there is a very, very short 5-question quiz that we have made available here. If you click on this link, it'll bring you to SurveyMonkey. You can see down here when I click on that, it'll bring you there and it'll just be a quick 5-question quiz to see what you've learned. There will be handouts in the comments that you can print and download. And if you have any additional questions or comments, go ahead and put them in the comments on this video and I will answer them. Thank you so much for watching the presentation, and I hope you all have a great rest of your day.